once again. This is Campus Exclusive, and today we are here with one fine gentleman. Actually, KSBSA is celebrating their week celebration, and as usual, we went there to pick some updates and a whole lot. And we came across one interesting speaker. He's going to educate us on one particular issue that it looks like most of we the youth are ignoring. And so I'm going to have a very lengthy conversation with him. He's going to take us through the process, why they've chosen that very topic to educate the public on. So stay glued to this conversation as I take you through. Honorable Mr. Amos Ando, thank you so much for honoring invitation.
You're welcome.
We are very glad that at least you are in our studio this afternoon.
I'm also glad.
Yeah, so just a quick one. Kindly tell us about yourself, who Mr. Ando or who Mr. Amos Ando is.
Okay, so Amos Ando, founder for Focus on Sickle Cell Foundation for Cell.
Okay.
And I'm also a journalist.
Oh, okay.
Oh, yes. I go by the name Akokwa Impenism.
Kai. Akokwa Impenism.
Yeah.
Interesting.
Yeah. Two say a kind of Akokwa Impenism. A band is a can. News presentation when it comes in local news and I'm good in those things.
Wow.
I'm a talent.
Wow.
So I've worked with a lot of media
houses. Okay.
In Ghana.
Yeah.
Yes, both Ashanti region and Central. Now I'm in the Central region.
Okay.
Yes. So that's where I work. So that is Amos for you.
Wow.
Yes.
I came for the KSBSA week celebration.
Okay.
Shout out to our president,
Sure.
Mr. Godis Kim.
Yeah.
And I saw the passion from which you were delivering your speech about sickle cell.
Okay.
Now, I also came across, I think this is the first time I'm hearing of Focus on Sickle Cell Foundation.
I see.
That is FOCEL.
Yeah.
Can you give us a brief, discussion or brief history about the whole foundation?
Okay. So, as I said, I'm a journalist.
Okay.
I always used to inform and educate.
All right.
So, last year I came across a report from one of our foundations here in Ghana. They also centered on sickle cell. And their report was like 18 to 20,000 averagely are children which are being born with the disease in Ghana each year. So me seeing the report, it was so heavy for me. Why am I saying that? Because I'm also living with sickle cell disease.
Wow.
Oh yes. So as a sickle cell patient who is a journalist, and when I saw the report, I was like, so what may be the cause? That each year, Ghana is, delivering 18,000 children suffering from
a quick one. I want us to blend the English with the tree,
okay,
so that people who are also watching us, who are not well endowed when it comes to the English language, can also flow with us.
Yeah.
So kindly try as much as you can to blend the English and the tree for me.
Okay, so
Okay.
Share reports are way back 2024. Showing that a lot of people living with sickle cell also. Yeah, averagely nipa be de obona live with sickle cell. But one more challenge thing is afibia no kwada 18 to 20,000.
Okay.
And you living with sickle cell disease in the nation, meaning that say 18 to 20,000. Next say awofo almost suffer for taking care of Malone living with sickle cell each year be 36,000.
Wow.
New couples. Yeah, can be shame also. Ma suffer from sickle cell. Say 18,000 now, you also but then say 36,000. Parents are almost suffer. Yeah, almost share quite almost sickle. So it's as someone who is into the media piece, maybe say may add a voice to national issue. And not just add my voice, but you say living with sickle cell disease is not easy. Sometimes crises are become complications are being restricted from doing normal things are ubiaye. And ubiya so an ambition, ubiya on vision. And Ebanisana na ase enyuma bi kechi wa brabuma. At long last, okra not okra wadin say I didn't crunch because you have 0.00 so when your crisis gravity not survive. And looking at all this now, na still and go forward and go down war sickle cell my name data. So I did my research. Not knowing that Sana, a lot of us are ignorant. Ohe lectures in correct course no. You say students in the say or genotype you're saying. Out of students no more be hundreds no. Few of them I know to me some more check your genotype. Okay.
I think say they all kind of very true because me, for instance, look at my name is genotype.
I see.
You understand? So it's
and probably you may have a girlfriend, Anna.
Okay. Yeah, so I think it's a very, very good thing.
Yeah.
So let's continue.
So as I was saying, you don't know your genotype, and she's saying a lot of people too are ignorant. And young because you focus on knowing our genotype. No, I should have you see, it's a local hospital. Now you can say you'll be HIV/AIDS positive and I be Bisanwa. And many pandemics
Yes.
But now sickle cell disease is more dangerous than HIV. Wow. Living with sickle cell disease and living with HIV/AIDS is more dangerous than HIV/AIDS. Why am I saying that? Because now living with AIDS, even the government is supporting people living with AIDS with drugs. Yeah, but sometimes you will see someone living with AIDS as compared to previous years. Now, you see the person to go through pains. Now it's not there again because in virus now this. But sickle cell disease is not something that caused by virus. It's hereditary, meaning that a blood disorder. Please do you understand? As a blood disorder, it's like something that I've been living with you forever and ever. Yeah, you can't do anything about it. All you can do about it is to maintain the sustenance and be on drugs until you pass out.
Now, I'm hearing sickle cell, sickle cell. People are saying, what sickle cell is, some of the symptoms. I don't know if it has.
Yes, it has.
Take us through the whole topic. Sickle cell.
Okay. Sickle cell is, as I said, hereditary. Sickle cell is a disease. Sickle cell is blood disorder. Sickle cell is okay. Now, a point as sickle cell is first one, Ubinibi, and a first Benny Pebiso, and I say, you won't pursue a PBA more fancy genotype.
Okay.
That genotype tells us clear to many parents, me papa, and my man, and the family. Into Ubia and San Yeba, a baby gene, and no baby gene, and I come my baby, who as any part. Now, gene, no. And maybe we are saying that papa genotype. So the word genotype if you gene in the body. So papa genotype, any my mini genotype, and Bushia, and I say I'm not compatible. Say ASR, meaning so ASR, we are sickle cell traits, meaning that the S is abnormal. The S will make akorana and as abnormal hemoglobin. It will be an red blood cells. A woman nipano it me a living life via okay. That just say many nipano a man and what the organs will be. So when it comes in sickle cell, send you AS. Now send me partner see AS. Meaning that ye be war akwadano I'll show you in creation. A bit never start akwada became me S. Me genotype or became one pay. See, so me AS or became me S. No, I pick my minister dear back. Now I become my own nipam. It is a many AS now my ministry AS, meaning Sakuran picking the S or picking my minister AS or AS sickle cell. Oh, yes. And this one is not something that doctors can do something about it. Say, when you are going to marry, doctors can say sakolana woba no mo gene SS na combine so you would do be and you will be abofun and say nipa to me and divert say me be a sickle cell member. Every maybe or developers not there.
And only be even with read the youth cramp.
Okay.
A very difficult say. Maybe most few churches now you say worry and also maybe you want to enter into relationship with the person and say type they say they saying so that at least we know say this thing that we are doing, it will help us in some future to come.
Oh yes.
Very difficult.
No, yeah, because you see, I didn't the more you educate, the more you advocate for the thing, the more it becomes serious. Yeah. The more it rings in people's see. So, okay, then that I didn't serious. That's why I focus on Sickle Cell Foundation. Because now you say a lot of youth, it's not like say only no measure that you intentionally give birth to someone who is a sickle cell patient. There won't be complications there one. Because as a parent, you see, and maybe say no problem back from 2015 until now. Many problem we almost say a family said never established, meaning we hit bone the right one. I say, wow, the doctors in some bay message with that one, and that cost me 150,000 Ghana cedis. Wow. Which is 1.5 billion for one hip. It is almost year hip 300,000 Ghana cedis. And now can the survivor say you be a bit an anti-normal in Amiasa. So you see, and to the beer, maybe not here, may no cast a fancy. A bit my best watch number from the small hospital because many crisis. And I'm not sure the son will be a person in Babicom. And you spending 500 cedis each month on drugs. Wow. And was sickle cell patients. It's not easy. So, meaning say, ye and from Swasi Shedda, name we are ignorant, Nimna, Yin. And once I say, okay, a lot of youth in jacket. Even Grandpa will be dating, and I saw a girlfriend, and I say, Ube Ware Grandpa. We always centered our mind on hepatitis B and HIV. Yes. Yes. But sickle cell is not about you, it's about someone that you are going to give to or everything. Okay. What do you say? Okay. So, all pass me, papa, they are not sicklers. They don't feel the pain that I'm going through. Why? Because it's hereditary. Okay. It's you see, sickle cell is one way or the other. Like you are giving pain to someone that is innocent about your choice. So, young parents, I'm gonna focus on Sickle Cell Foundation. And I say, your choice can bring someone pain. Your choice can take someone so many years to find out say, oh baby, because it's too the nurse in the hospital. And I say, yeah, the ventilator seems so. The man oxygen, you go through pain. They are very wicked. Why? Because that ain't no better there to bring me this pain. You see, it's sickle cell and they're easy. And lifespan of people living with sickle cell, I'm not putting fear in anyone, and I worry you'll be able to see me. Say me a sickle cell or you might into them input fear in that person. But sometimes the survivor will go to him 5 years, cram or try in Hamiabima. Yes. A lot of you who are 24 who are past 21 who, because we have complications to say acute chest syndrome and also a crisis I will come with chest in Nabe how Wakuma and complete Mujani to say, oh, find it difficult to do. You see, aside that, also, a idea I'm to two joint pains. And see, my brother, it's not easy. Me co-investing. Even me university, I mean, sometimes see a treasure so crown makes exam paper and quite metro and work. So the bit number so won't say he score me 000. No be better, I'm not being smart. Not that too. At that point, I'm no lectures are exams. I'm also going through pain. So now the person will be there. It's no way you can be there. I mean, be here. A corona do one. They are on quite new. So sickle cell is very dangerous.
Wow, a quick one. This is campus exclusive, and we are watching us live with Mr. Amos Ando, who is the founder for Focus on the Sickle Cell Foundation, that is FOCEL, and he's teaching us about a lot that maybe you and I may not even have any information about. Now, my next question to Mr. Ando.
Okay.
Let's assume my main country.
Okay.
Let's assume say we be so checking the states. For we share is here.
Okay.
Or so share say whether the person is having the sickle cell cell or not. What are the procedures? How there's a meeting I go through for the person to know that I am AE, I'm AS, or I'm this.
Okay. So we have two types of sickling tests.
Okay.
We have the normal sickling test, which will tell you either you are negative or positive. Of which are many institutions, especially the government institutions, hospitals are already on here. I'm saying about another one be developing be say me a sickling negative, meaning me A and I see A C.
Okay.
Say me a sickling positive, meaning me AS, SS, SC, AC, and then you can. And meaning that you have the sickle cell in you. So now the threat. So the AS is a threat. We ASR, we a threat. Who needs sickle cell you already be. But who offer will be on your AS, I'm about work on our sickle cell. And now SS maybe is someone living with the disease. SS a typical sickle cell understand. Meaning say a sickle cell patient, but a sickle cell type, and I'm a sickling type, a SC. But what I say, a S. And a old so media no a AC. Into no AC no company a normal, but those having a SC, SS, AC no, and I say AS no, a problem. Into the entire obi genotype no so the big kind. Normal sickling test no hospital now. They will just tell you whether you are negative or positive. But you are another procedure where we go through a friend say HB electrophoresis. And on focus on sickle cell foundation, you promote genotype and different genotype checking. Say, genotype now, there's no meaningful way to go further to know even your sickling status because you know it already. So your genotype is something that we are educating the public on. Knowing your HB electrophoresis status, which is so we AA, we AS, we SC, we SS. And no matter what my young the type away. It's mainly say no me must be SC. So oba meet me aware. And I say and our oba meet me aka say me ne yo. Oba E and I say she. And I tell you, say, meanwhile, I say, mean decide crossing no bed, they'll cry, tell me one in say, me whom men say no, I won't just fall for love, say the men will be oba no and it's not be nature, but I will go in and go ahead to marry that lady or that beautiful girl because as I say, some qualities be a one manager or a is. Into say young people I have youth. I will encourage each and every one of us going in for love is something okay, but it's not enough. Because at the end of the day, meaning a lot of parents are more agile because of my sickness. The reason they say Obana se be mani deceive you. Ebi a wo share me no me sickle cell patient too. But many see me AA. But what I say, now I go ahead na me na worry. Na akwa kwada bi etesa. Nti we be find out no be say say na me kan anya no kore no. Na eno so akoye problem. You see. So that is the issue. Wow. Yeah. So we have normal sickling test and then HB electrophoresis, which is the genotype. And now focus on sickle cell foundation. Educating the public. Knowing your sickling, either negative or positive, is not enough. But go further to know your class.
Walk us through the stigma involved.
Oh, the stigma no is not easy. Sometimes it's only be a one some symptoms be will be shown now will be out to this way a circle. Okay. But what I say, especially the younger ones, so go school, na say teachers need to go and so your sickle cell patients. Obi a nurse one You get? So sometimes you may do something that won't please the teacher. Instead of the teacher to cane you, I remember when I was in SHS, instead of the teacher to cane you, the teacher will just use this word. Oh, yes, class, or you see, it makes that person so sad, so pain. It's like I say, what is the kind of one? And then especially me starting with this my journey, one thing so I'm realizing is we say when you sickle cell, whilst I mean can be status in also it's high iPhone. Sickle cell there, me my dad will call yale in wo me so mo yale basa san, but just you see. So with that one also a perception be on for now who cause it? You see, who cause it? So obienya no say omo yes yare for omo nche no man omo but who cause it? This is the situation. See, also a big gap. The one even criticizing it don't even know that he or she is the one causing it. So before you know, say okra na wo cause it to bring forth a child like that. Let's say so that will save many lives. Yes.
Now, focus on Sickle Cell Foundation. I know currently you are in Kenya University of Wasa campus.
Yes.
How many campuses have you been so far? And what is the general scope? What are we supposed to expect from you? What do you want in order to push this kind of whole idea or whole goal forward?
Okay, so focus on Sickle Cell Foundation. We are only centered on creating awareness, and then making sure that everyone knows their genotype, either you are young or old. You see, for that reason, we are beginning doing our public education and school outreach. That's why we are here. So the public education and education outreach, what we are going to do is that it's not everyone that is schooling. So those who are not schooling, how are we going to make sure that this information will get to them? That one too, we have to go to those places like churches, markets, the community itself, to make sure that everyone will know more about sickle cell. And then also, we have counselors who are also with us, especially as you said, the stigma attached. So we have counselors. In case maybe you are in a certain relationship, you've built this relationship to a certain level and maybe you've checked your genotype. Both of you are not compatible, meaning that you are AS and your partner is AS. You separate, sometimes it's not easy because you built your relationship for 7 years. Yeah, you see, now what do I call mama said? And I always say, love is the biggest thing in the world. Even the Bible also talks more about love. And loving someone is not easy. And then withdrawing from someone you love is not easy. And the same time, they say, Obi aqua checking genotype. No, me no money are compatible. Now, might be a double relationship to a certain level. A conversation between a convince woman to make sure that on separate it should be a man as on tongue to say, oh, we are still going to marry or give birth. Because if you go and give birth, you are going to bring forth a sickle cell patient to suffer. But what I say, so we have our counselors around, and also advocacy there. We are doing it everywhere. But our long-term vision is to build Sickle Cell Teaching Hospital in Ghana.
Wow!
And this Sickle Cell Teaching Hospital, I will say, a lot of nurses don't even have more idea on sickle cell. Especially say as a sickle cell patient like myself. Minya crisis na me call hospital. It will be a nurses they are afraid to even touch me or get close to me or give me medications because they know so omma wadura obetimi afunu. Yes. Obi anso mpese obewo duty be wu atono so they always wait for doctors. But doctors say, oh my God, you say so yes. Nurses are plenty than the doctors that we have. So the teaching hospital is not only going to take care of people living with sickle cell, but we are going to give training to nurses. Say the nurses too will have some courses. That is our long-term vision. One price. There's been a lot of sponsorship. Now we need sponsorship. We need corporate institutions like others. Nobody Ubia say Omumbra on board to help Focus on Sickle Cell Foundation. Because now we are going to set a national standard to make sure that we fight sickle cell boot for boot. We are reaching the grassroots. You see, SOB Atinka. It's now that we are on campus outreach. We'll be going to the communities. We'll be going to our churches, the market sector, everywhere. Wow. For everyone to know more about sickle cell. Yes.
Now, maybe you have some address number if someone wants to reach out to the foundation.
Okay.
Can you give us some address?
Okay, so our social media handles is Sickle Foundation Official. Sickle Foundation Official on Facebook, on TikTok, Instagram, Twitter. It's focused on Sickle Official, and I focus on Sickle Cell Foundation Official. Unyabo Sickle Official, and as I focus on Sickle Cell Foundation Official. Then you get us. And then also, you develop a website with our network. And if you want to contact us, 054 75 92 394. Yes. So that's our contact. Yes. Now we are inviting everyone. The one says sickle cell is advocacy there because you students voting campus there they could be an senior reps. Yeah, any point say me free baby bansan there. We say you be asked because you Jimmy Pebin one. But what I say, into Ubia is welcome to also join the research. Yes.
So we share and I say he's also interested to join the campaign. The person can also call the number.
Yes.
As stated by our very own brother, Mr. Amos Ando.
Yeah.
Then the number is 0547 592394.
Yes, exactly.
0547 592394. Now, Mr. Amos, final words to the public.
Okay. So focus on Sickle Cell Foundation. Aside we creating awareness, doing advocacy on sickle cell, we are also urging the government through the Ministry of Health. There are people living with sickle cell. There are a lot of crises they go through. But Oko Hospital, sometimes you have to pay all your bills, including even the folic acid. Folic acid is something essential drugs that you take each and every day. But when you have crisis, you have to go and pay for it. Especially, so Obi or crisis now, Obi to your 1,000 Ghana for one crisis, and Sana it's me. We are urging the government that at least if they can help us, people living with sickle cell, through the initiative of National Health Insurance Authority, to make sure that people going through sickle cell say pay medication, say they more how our emergency cost government will take even half of the bills. So they be a because a hereditary. You can get crisis 4 times in a month. So imagine 4 times in a month and you are paying 1,000 Ghana cedis for one crisis in Ghana. Meaning you are paying 4,000 Ghana cedis every month. So nipa no ye no Bank of Ghana kwana. Onfili and ask in Sikan ebesa. And you have to live with it until next year. And also whether you live with it because adeno a chronic. So we urge the government, individuals, corporate institutions, people living in sickle cell because it's not easy. People are suffering silently, but now focus on Sickle Cell Foundation. We want to bridge the gap, making sure that people living in sickle cell to have a say and also have a way to sustain their moment so a good living. Thank you.
Thank you so much, Mr. Amos Ando, for your time. Really appreciate your presence. This is campus exclusive, one-on-one with Mr. Amos Ando, who happens to be the founder for Focus on Sickle Cell Foundation. Now, we are going to meet some other time. Stay tuned for more updates.